living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Every year, thousands of Americans get sick with diseases that can be prevented by vaccines. People with chronic conditions such as diabetes, respiratory issues, and heart disease are at a higher risk, not only to get these diseases, but to suffer from serious problems because of them. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today, we'll talk about chronic conditions and vaccines. Stay with us.
I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
I was outside working on some equipment, nothing too strenuous. I started sweating and feeling out of breath.
When he felt pressure in his chest and aching in his arms, I knew we had to call 911.
First responders were there before we knew it. 38 minutes later, the doctors had restored the blood flow to my heart.
Now we know dialing 911 saved his life.
Your life is on the line.
This message sponsored by Mission Lifeline Montana.
Out here, we love our animals, from the wildlife to the livestock. Inside, it's the same. They're just like family. We keep them happy and healthy, most of the time. Secondhand smoke puts pets at risk for cancer, feline lymphoma, vomiting, increases the risk of tumors and lung cancer, even causes eye and skin disease. Secondhand smoke puts your pet's life at risk.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Welcome back to Healthy Living for Life. Joining us today is pharmacist Tony King, who is the Director of Pharmacy at Mountain Pacific Quality Health. Tony, you're starting to become a regular, so thanks so much for coming back and being on today.
You bet. I appreciate the opportunity.
So we've certainly talked about chronic conditions and chronic diseases on Healthy Living for Life before, but it's probably worth just reviewing quickly. Can you explain what it means when we say a condition or a disease is chronic?
Yeah, chronic diseases generally are ones that you have to live with every day, that you probably will live with for more than a year, that you need ongoing medical care, or that really inhibit your daily activities.
Okay, perfect. And according to the Centers for Disease Control and Prevention, or often called the CDC, 6 in 10 Americans live with at least one chronic condition. Can you talk about some of the more common chronic conditions that are out there and how likely it is for an American to have one of those diseases?
Yeah, the most common chronic disease that affects Americans is cardiovascular or heart disease. Generally, 1 in 3 Americans will die from this condition. Other conditions, diabetes, asthma, cancer, arthritis, obesity technically is a chronic disease. So really, of the healthcare spend in the United States, the majority of it is coming from these chronic diseases. Heart disease will cost over $200 billion this year,
wow.
And it gets up into the trillions really quickly.
Wow, and is that pretty typical around the world, or is that specific to America?
Americans lead the world in spend on chronic conditions. Unfortunately, we have a higher incidence of obesity and sedentary lifestyle. So unfortunately, the United States spends more of its dollar on healthcare for chronic conditions than anywhere else in the world.
And on that same track, I just recently read that chronic conditions contribute to 90% of the nation's annual healthcare costs. So can you talk a little bit about the economic burden and maybe just the burden in general that chronic disease has in the United States?
Yeah, really, as you said earlier, 1 in 6 Americans is living, 6 in 10 is living with chronic health conditions, but technically 4 in 10 have more than one. So for those that have diabetes, they probably also have heart disease or cardiovascular disease. Those with diabetes also have other health conditions, obesity, high blood pressure. So really, it's not just one thing for one person. It is a lot of times multiple conditions for multiple people.
And we know too that folks that have one or multiple conditions are at higher risk for getting other infections and diseases or getting complications from those diseases. Do we know why that is?
Well, generally the thought is that your body is already working hard to adjust to your chronic disease, so it leaves more opportunity for those other infections or other conditions to creep up, because your body is so focused on trying to adjust to what it's dealing with your chronic disease.
Okay, that makes sense. We talk a lot about disease prevention, and then we also talk about how to manage a chronic condition. Can you talk about what the difference is between prevention and management?
Sure, and with these chronic conditions, a lot of times they overlap. But prevention is before you actually have the chronic disease, and then treatment or managing it is when it's already been diagnosed and you're doing what you can to keep it under wraps. More often than not, it's eating well, getting more exercise, following your doctor's scheduled routines, making sure that you're getting checkups regularly, getting your vaccinations. But really, you want to prevent it if you can, but when the doctor finds it, then we really need to work on managing it.
And as you just mentioned, vaccinations is part of management, and that might be one that people don't often think about. Can you just talk high level, generally speaking, because we'll dive into this a little bit here after the break, but why is it important for people to get vaccinations, especially if they are trying to manage a chronic condition?
Sure. Well, your body's already dealing with so much. So people with chronic conditions, if they get one of these vaccine preventable diseases, generally the complications from that disease could be worse than if you didn't have a chronic health condition. So just trying to make sure that your body is taking care of itself and managing that chronic disease, and therefore decreasing your chances of complications from one that may be prevented by the vaccine.
Does having a chronic condition ever make a vaccine risky or dangerous for somebody?
For the most part, no. Obviously, if you're undergoing treatment for cancer, or if you're on medications that may already weaken your immune system, you want to talk to your doctor or pharmacist about the chances or what may be right for the vaccination. But for the most part, no, you're fine. Okay.
And you just mentioned your immune system. So let's talk about being immunocompromised. What does that term mean?
It means that your immune system is already weakened. Your body is working on taking care of something else, and it doesn't have full capacity to take on something new.
What are some of the reasons a person might become immunocompromised?
Generally, you're already have an infection, you're already fighting, if you have cancer, your body's already trying to take care of that tumor. You may be on medications. You may have just gotten over being sick. If you've had the flu or if you have a cold, your body is already weakened. So it varies from person to person.
Okay, perfect. Tony, thanks so much. That's great information. We do need to pause here for a quick break. But coming up next, we're going to dive into some of those chronic conditions and specifically talk about what vaccines are best for folks who are trying to manage or take care of themselves with a chronic disease. Stay with us. We'll be back after these messages.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
I take care of my wife at home. When I found out training was available, I said, sign me up. It's made a huge difference.
When my husband was injured at work, it was life-altering. The classes taught me that it's okay to grieve, to ask for help, and to better cope as a caregiver.
My dad lives 4 hours away, and the Powerful Tools classes taught me that it's okay to ask for help. I highly recommend them.
To find out about this course for caregivers, go to powerfultoolsforcaregivers.org.
It's amazing the difference a little training can make.
Life is made of stories. Stories that we all share. But some of us have a hard time reading due to a vision, reading, or physical disability. The Montana Talking Book Library is here to help. Call 1-800-332-3400 to learn if you qualify for this free service, because no story should go untold.
Welcome back to Healthy Living for Life. We're talking with pharmacist Tony King, and we're going to talk specifically about some chronic diseases and vaccines that are right for folks who are managing those diseases. But first, let's talk about some of the more common vaccines. So thanks for staying with us, Tony. First of all, I'm sure the majority of us have heard of the flu shot that we're supposed to get. And then another major one is the pneumococcal vaccine to protect against pneumonia. But what is the Tdap vaccine?
Sure. Tdap stands for tetanus, diphtheria, and pertussis. So these are this is one vaccination against 3 different bacteria. More commonly, tetanus is used to prevent lockjaw, and the whooping cough vaccine is the pertussis part of that. You're often vaccinated for it as a child, but sometimes you need to catch up in adulthood.
Okay, and another common one is called the zoster vaccine. Can you talk to us about that one, please?
Sure. This vaccine is to prevent shingles or adult chickenpox. It's the same virus that you were vaccinated or possibly had as a child that causes chickenpox. It just lays in your body dormant, and then more often than not, when you have an issue that weakens your immune system, it pops up. So this vaccine helps prevent shingles, and if you get shingles, it's often less severe if you've had this vaccine.
Okay, great. So now let's dive into some of the chronic conditions that folks might have. And let's start with heart disease, since that's so prominent. And when we talk about heart disease, it's important to note that that includes people who may have had a stroke in the past as well. So why are vaccines important to people who are trying to manage heart disease?
Yeah, well, one, your body's already trying to deal with something, so it leaves you at higher risk for complications from the flu or pneumonia. But when you can get these vaccine preventable diseases, it can also increase your risk of having another episode of a heart attack or a stroke.
Okay, and what are there specific vaccines that are recommended for people with heart disease?
Yes, we mentioned a couple of them prior. So the flu shot, the pneumonia shot, there's actually 2 different pneumonia shots. It is recommended that you get both. The Tdap and the zoster are the 4 major ones that are recommended.
Okay, let's talk about diabetes next, which, as we know, diabetes affects millions of Americans. Are there reasons specifically why folks with diabetes should pay attention to getting vaccines?
Absolutely. When you get sick and you're a diabetic, it can cause an increase in your blood sugar, and it can cause more complications in your diabetes. So making sure that we're trying to prevent these the best we can help you manage your diabetes, especially. But it also, when you have diabetes or you have these and your blood sugar goes up, it can affect your liver as well.
And I understand the 4 vaccines you talked about before are recommended for diabetes, but also the Hep B vaccine. So we didn't talk about that one earlier. What is hepatitis B?
So hepatitis means inflammation of the liver, and in this case, it's caused by a virus. So it is one of the 3 types of hepatitis. There's hepatitis A, B, and C. This one is a virus, hepatitis B. So the vaccine, the Hep B vaccine, just helps prevent inflammation of the liver.
And what are some of the complications that hepatitis B can cause?
Sure. Hepatitis B, if it keeps proliferating or it gets worse, it can increase your chance of liver cancer, liver failure, and possibly even death.
Can you help us understand why diabetes and the liver, and specifically hepatitis B being an issue, how are those all connected?
Well, your liver helps regulate the amount of sugar in your blood. So when we affect the liver or we have inflammation, your blood sugars can increase quite dramatically. It can cause a fatty liver. It just decreases the ability of your liver to function, and it's already trying to battle that as well. So it just kind of causes a circle in which the liver may never come out.
Okay. And as we've been discussing, you can prevent hepatitis B with a vaccine, protecting yourself and your liver. What can someone expect if they go in to get a hepatitis B vaccine?
As far as the vaccine goes, really, it's a fairly mild vaccination. Really, for most of these, it's just going to cause local soreness where the injection site was. Some other vaccines may cause you to, feel a little run down for a day or two, but more often than not, it's just where the shot went into your arm.
Other than people with diabetes, are there other folks who should be looking at potentially getting a hepatitis B vaccine?
Really, anyone that hasn't had it, often it's vaccinated in the childhood schedule, but if you haven't had it, we do recommend that you get it. Folks that may be traveling to areas that don't often vaccinate for hepatitis B or have a higher incidence of hepatitis B in those countries, or people that possibly work or are exposed to blood products.
Okay, so are there people who should not get the hepatitis B vaccine?
Really, unless you're allergic to components inside the vaccination, there is no real reason not to get it.
Okay, great. All right, we do need to pause here for another quick break, Tony, but we'll talk about other chronic conditions and recommended vaccines, and we'll learn where, when, and how you can get those vaccinations if you need them to protect yourself from these common contagious diseases. We'll be right back after these messages. Stay with us.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
I had a terrible fall in December, and I put a hole in my wall. I hit it with my head, and it really, really scared me. The Stepping On program gave me confidence. We had a physical therapist come. He gave me specific exercises to strengthen my legs. I think that a lot of people in Montana need to take this program. We all think that we get to a certain age, you hit 60, and we expect to fall. You don't have to.
Final call from flight 566. Hello, gentlemen. May I see your Montana Real IDs?
IDs? Why, I'm Captain Meriwether Lewis.
And I'm Captain William Clark.
Hang on, I see more than one William Clark.
It's the real me, I promise.
Discover more at mtrealid.gov. Available now.
Montana Real ID. It's the real me.
And me.
Good care is your right. In Montana, there's over 11,000 beds in nursing homes and assisted living facilities. If you or a family member needs assistance or help in obtaining information about care issues and placement options, call 1-800-332-2272. If you or a family member need information about Montana's long-term care resident rights, or if you need help solving a problem or a complaint about a nursing home or an assisted living facility, call us at 800-332-2272.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, and my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
Welcome back. Pharmacist Tony King is still with us this morning, and we're going to continue to talk about some chronic conditions that folks might have and vaccines that would be recommended for them. So Tony, thanks so much for sticking around with us. So let's talk about chronic obstructive pulmonary disease, or COPD, and asthma. What vaccines should people be looking into if they are trying to manage either of those, or maybe even other respiratory issues as well?
Sure. The vaccines that we mentioned prior, so the flu, the pneumonia, the Tdap, and the zoster are the ones that are recommended for patients with COPD or asthma. But again, depending on your other conditions or your age, the doctor may want you to get some additional ones as well.
Okay, and if someone is dealing with COPD or asthma, what are some of the complications they might face if they get one of these contagious diseases because they did not get vaccinated?
When you have COPD or asthma, a lot of times the lining inside your lungs is inflamed and may be producing some more mucus that helps or that blocks your airways. So you're already having problems breathing. So if you get the flu or you get pneumonia, your body can't fight it off near as well. So if you have pneumonia and you already have asthma or COPD, it can really fill up the lungs with that mucus and really make it hard for you to breathe, and then you could get complications and have to go to the hospital, etc.
Okay. So we talked earlier a little bit about people who are immunocompromised or they have weakened immune systems. Are there vaccines or preventative measures that folks that are dealing with being immunocompromised might want to talk to their doctor about?
Sure. The 4 vaccines that we mentioned prior are all recommended for anyone who's immunocompromised. The doctor may also want to look at human papilloma virus vaccine, or HPV vaccine. If you're under the age of 26, there are extenuating circumstances where they may recommend that vaccine if you're a little older, but it is a fairly new vaccine and they're still trying to get their hands around when and where the right time to use that vaccine is. But again, if you have other health conditions, the doctor may want you to get caught up on some of the other vaccines as well.
Okay, and you mentioned earlier, too, that everyone's different, so depending on age or other things that might be going on with them, there may be other vaccines that would be recommended. Where do they go? Who should they talk to? Are there resources out there so people can really understand which vaccines are right for them?
Sure. A very good resource, or the best resource that we have, is the Center for Disease Control, or CDC. If you just type in cdc.gov/immunization, it will pop up a whole list in there, and there's schedules inside that website that will show you when and where, or when and how you should get those vaccines. The doctor's office is a great resource as well, and if you're having a tough time, you could also call your pharmacist. The pharmacy should be able to tell you which vaccines, especially if you're traveling to foreign countries, they can kind of help recommend which vaccines you may need to use depending on where you're going.
Okay, great. So a lot of options for people to get some information. What about timing when it comes to vaccines? Are there specific times when people should be looking at getting vaccinations? Some of the ones that we've talked about so far this morning?
Generally, no, you're okay. Some of the vaccinations, though, require a series, so more than one shot, and the timing in between those shots varies depending on the vaccine. Some of it needs to be 28 days apart. Some of them recommend a year apart. So really working with your healthcare provider and your pharmacist to make sure that the timing aligns real well. The general recommendation is if you're getting one shot, you can get more than one shot. But if you've had it, then you may need to wait a little bit before you can get another one.
Okay. And we talked a little bit, you mentioned possible side effects. Can you speak specifically to some of the side effects and if they're different depending on which vaccine you're getting?
For the most part, the side effects really are just going to be local soreness from the injection site. Some people feel run down for a day or two. Some of the vaccines, the older shingles vaccine, it comes frozen and it goes into the back of the arm instead of into the muscle part of the shoulder. So those ones sometimes have a little bit more irritation locally. But generally, there really is very few side effects with these vaccinations.
Do health insurance plans usually cover the vaccines we've talked about? Medicare, Medicaid, private payers?
Yes, part of the Affordable Care Act that was passed stated that any of these disease-preventable vaccines can and should be covered by the insurance. Medicaid does cover it. Medicare Part D covers those as well as most private insurances, generally for no copay.
Okay, that's good news. So people with chronic conditions have a lot to keep up with when they're trying to manage their day-to-day to make sure that they're doing what they need to do to stay as healthy as possible. So their immunizations, that's just one more thing to put on the list. Do you have any tips of how to keep track of those immunizations? Anything to make that a little bit easier for folks?
Sure. We all, I have it in my wallet. We have the card that lists the vaccinations and the dates and the initials from who provided the vaccine. Depending on which provider you go to, they may upload your vaccinations into a registry in Montana. It's generally MTRAX is the name of it. Pharmacies can also upload those vaccinations into a database that's stored by the state so that you can have access to it as well. But just keeping good communication between your providers, your pharmacists, they can all document in there which vaccines you've had, when you've had them, and when you may need another one.
And you just mentioned providers. Oftentimes folks who have chronic conditions are probably seeing specialists or other kind of healthcare professionals. Is that a place to start too when it comes to keeping track, what you need, who you can talk to when it comes to vaccines?
Absolutely. Your provider's office, and most of them now have online portals or web spaces for you to go in. They're the best and first resource you should have, making sure that they have all your documented health conditions, all of your visitations, anything that another provider may have recommended. But the most important thing is to let them know. A lot of providers, especially primary care providers, didn't know that you went and saw someone else or had a different procedure done. So just keeping that line of communication open is very important. Okay, that's great advice. We're actually almost out of time. Any final thoughts or tips that you have for folks this morning? Just stay safe, stay healthy. Make sure that you're up to date on all your vaccinations, and hopefully you'll be okay. Perfect. All right, Tony, thank you so much for your time and your expertise this morning. We appreciate it. You bet. And thank you so much for tuning in this morning. We're so glad you came by to see us. We hope you'll come by and see us again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Production facilities provided by Video Express Productions.